I'm Sam. I'm going to be your student nurse today. How are you?
Good, how are you?
Good, thank you. Could you tell me your full name and your birth date?
Olivia Young, 8/30/96.
Perfect. And what do you prefer to be called?
Just Olivia.
Okay. Could you tell me where we are?
Burlington.
And today's date?
January 28th, 2020.
And who's the president?
Trump.
Perfect. Okay. I'm going to do a quick head-to-toe assessment on you. Is it okay if I touch your head?
Yeah.
Okay. So your hair looks nice and shiny and healthy. I'm just palpating for any bumps, looking for lesions. It looks good. Now I'm going to palpate your ears. They're symmetrical. You have piercings but no sign of infection. How's your hearing?
It's good.
Good? Okay. Now I'm going to assess your pupils. Just look at the tip of my nose and I'm going to shine a light in your eyes, okay? Good? Good, okay. Your pupils were round, symmetrical, and accommodated to light accordingly. They started at a 4, constricted down to a 3, and then accommodated back to a 4.
Okay.
So now I'm going to check your cardinal fields of gaze. If you could keep your head still, but follow the tip of my pen with your eyes.
Okay.
Perfect. Could you stick your tongue out and say ah for me? Okay. Your mucous membranes were pink, moist, intact. I didn't see any lesions or cavities, and your uvula was midline. Your face is symmetrical, and your color looks good. Could you shrug your shoulders up for me? Perfect. And now I'm gonna go down your arms. Let me know if there's any pain or tenderness, okay?
No pain.
No pain? Okay. I'm gonna palpate your radial pulses. 2+ equal bilaterally. I'm going to assess your skin on your arms. It's dry, warm. I don't see any bruising or edema. It's intact. I'm going to check your capillary refill. Good. Equal about 2 seconds. Could you squeeze my 2 fingers? Great. Equal strength. Okay. So now I'm going to do a respiratory assessment. If you could take a nice deep breath in every time I move my stethoscope, that would be great. Okay, great. Your anterior and lateral lung sounds were clear. I'm now going to move to the posterior. Nice deep breath. Okay, great. Your bronchial lung sounds were clear. Your expiratory was greater than your inspiratory. Your bronchial vesicular were all clear, and your inspiratory and expiratory sounds were equal. And then your vesicular, your inspiratory was greater than your expiratory. And then could you do one more deep breath for me? Okay, great. Equal contraction and expansion. I'm now going to do your pulses. I'm going to palpate your carotid. Other side. Okay, 2+ equal bilaterally. And now I'm going to palpate your heart pulses, okay? Aortic, pulmonic, Erb's point, tricuspid, and mitral. So now I'm going to listen with my stethoscope. Aortic, center intercostal space, right sternal border, S2 is greater than S1. Pulmonic, second intercostal space, left sternal border, S2 is greater than S1. Erb's point, third intercostal space, S1 and S2 are equal. Tricuspid, fourth intercostal space, S1 is greater than S2. And then mitral, fifth intercostal space, midclavicular line, S1 is greater than S2. So I'm just going to continue auscultating as I palpate your carotid. Your pulses are equal. And then I'm just going to go over those again with the bell of my stethoscope. Okay, great. And then could you just take one nice deep breath in for me? Okay, great. No abnormal pulsations, bruits, or murmurs. I'm now going to have you lay down. I'm going to auscultate your abdomen and listen to your arteries.
Okay.
The bell. Aortic. Bilateral iliac. Bilateral renal. And bilateral femoral. Okay. Your abdomen looks good. I don't see any distension or edema. It looks taut and round. I'm going to listen with my stethoscope now to your 4 quadrants. Bowel sounds present in all 4 quadrants. I'm now going to palpate. Let me know if you feel any pain or tenderness, okay?
No
How's
pain.
that? Good? Okay, perfect. Now I'm going to move down your legs. Again, let me know if there's any pain or tenderness. Okay? All right. Your skin color looks good. No lesions, edema. Again, warm, dry, intact. Now, I'm gonna feel your posterior tibialis pulses. 2+ equal bilaterally, and your dorsalis pedal pulses. 2+ bilaterally again, and I'm going to check your capillary refill on your toes. About 2 seconds, good. Could you push up on my hands? And then push down. Great, thank you. Now could you sit up? And how has your GI been? Have you had a bowel movement recently?
Yeah.
Yep, and your urination?
It's fine.
Okay, good. Now I'm going to check your reflexes. Perfect. And then if you could stand up and take a couple steps for me, I'm just going to assess your gait. And then back to me. Great, steady gait. Don't need any accessory items for walking.
No.
Perfect. All right, have any questions?
No.
All right, thank you.
Thank you.